Hi, I'm Dr. Chong Chern Hao. I'm a gastroenterologist under GUTCARE. Colorectal cancer screening can be done using a simple test kit known as FIT kit or Fecal Immunochemical Kit. This test is very easy to apply and can be used at home and send the kit back to the office using a post. This test is important because it can detect the blood in the stool, which is one of the ways we can find out whether a person is at risk of having colorectal cancer. The principle behind this test is because when the colon polyps grows over years, it may become larger and the surface of the polyps may become abnormal. This is especially in the case of colorectal cancer, where the surface of the cancer is abnormal and friable. So when the stool or the feces passes through the intestine or over the growth, some of the surface may get injured and as a result, bleeding may occur. This is the FIT kit that we use to examine the stool. So you open up the test kit and you probe itself into the feces up to 6 or 7 times to obtain adequate sample. And you put this sampling kit back into the package that came with it and you can post it back to Singapore Cancer Society. And this kit is free of charge. The Cancer Society will inform you the test result within 7 to 14 days.